Astoma Sadgamaya Tamsoma Jyoti Gamaya. O Lord, lead me from untruth to truth and darkness to light. Jai Hind, Namaskar, and greetings to all respected, honorable dignitaries, guests, and dear participants. I, Dr. Geeta Parwanda, working as Dean Faculty of Nursing, welcome you all in the first Nursing Innovator Forum meet under the umbrella of InnovatioCuris Foundation of Healthcare and Excellence and non-profit initiative under the main aim focusing for healthcare innovation at low cost, as health is a right of the individual. And it is a glorious moment for us that the founder, director, chairman of InnovatioCuris Foundation of Healthcare, Dr. Surgeon Admiral Dr. Singh sir is there in this event, and sir is there to give his deliberation, give his guidance. Sir has a huge experience in his professional medical journey. Sir had a tenure of president of AHA, founder director of International Institute of Health Management. Sir received service medal to Zambia by the President of India. Sir is the author of 3 books. With respect, I invite Honorable Dr. Singh sir, who is a great leader, mentor. Sir, please come and shower your blessing to start this panel discussion on the aim, health innovation, trends, nursing practice, and innovation. Please, sir.
Thank you very much, Geeta. It has been really grateful to introduce me to the crowd. Today, we are having first deliberations of the Nursing Forum, and which was my really dream. I was trying for 4 or 5 years, but I did not become success. I was trying because I said, this is the forum for nursing, so they should come forward, they should become member, they should run it and update their knowledge. The idea came to me when World Bank had launched a training program for the nursing superintendents or the district hospitals, and their knowledge, what was there, was really very, I can use the word, was beyond any expectations. They did. I'm not talking of the nursing. Nursing, they are the masters.
So here I am back again with the introduction of honorable dignitaries who are there as panelists. We have keynote speaker, Dr. Rathi Balachandran, who was a former assistant director, general nursing at Government of India, and at present working as professor in RML. Madam had her BSc nursing from Medical College, Calicut, Kerala, and she had her post-graduation in community health nursing and PhD in nursing through INC WHO Consortium in 2015. Madam was a task force in charge for a common review mission of National Health Mission in 2016, 2017, and 2018. She has worked as a team leader for nurse practitioner, critical care, midwifery, trauma and emergency. Madam and also developed many induction program and promotional courses for nurses in 2017 and 18. Even she has worked as a member of the MOU UK for nursing in 2022. Madam is a renowned leader in nursing, and she was a INC and DNC inspector and examiner in various universities. She is also an external assessor for public health facilities under National Quality Assurance Standard. I request Dr. Rathi Balachandran, Madam, to please come and speak and share your views with such a huge experience as a nursing leader, nursing administrator, and nursing educator. on topic healthcare innovation. Madam, please.
Very good afternoon, one and all. Respected dignitaries, Vice Admiral Dr. Geeta, the panelist of the day, and the dear participants. I appreciate the organizers for selecting such an important topic and having the panel discussion on innovation in nursing. I congratulate all the nurses in the year of nursing 2022 and also for the decade of nursing and midwifery, based upon the fact that if the effective contribution of nurses and midwives are important for sustainable development goal and universal health coverage. Today, I am happy to be with you to discuss on the topic of serving on organizational boards, what nurses needs to know. Let me start the discussion with quoting Dr. Tedros, that nurses and midwives are not only essential for delivering the health services, their experience and knowledge are also valuable assets in shaping health policy, and their voices deserve to be heard at the policy making table. This was his quote during 2018 February, when the Nursing Now campaign has been launched. The countries around the world face huge challenges in providing healthcare to their people because of the scarce resources and the rising burden of chronic disease like diabetes and the impact of emerging factors such as climate change and migration. And now the global pandemic and healthcare cost further highlights the need for nurses to be at the decision-making levels. Nurses and midwives play a central role in all health systems, and we support people in every aspects of their health and well-being, from health promotion to chronic disease management and specialist services. Together, we make up the half of the professional health workforce globally and also account for about 90% of the contact between the patients and health professionals. And the countries, it's also evident that the countries that invest in and develop their nurse and midwifery workforce can achieve a rapid, cost-effective expansion of high-quality universal health coverage. Already the nurses are effective leaders in various healthcare organizations, and more than 10,000 nurses are on board in America. Nurses are professionally prepared to offer a substantial contribution at the board level, and they possess wide range of skills gained from the experiences that are transferable to the board duties. That is, in their daily activities, they are accustomed to balance interest and power of stakeholders, multidisciplinary communications, the connections beyond one's employment position as advocates for the people, and understanding during her daily practices, they are understanding the complex clinical situations, the unique relationship between the patients and family, and the ethical practice, moral values, as well as disciplines. These skills they gain as a part of their daily experience can be transferable to contribute effectively as a board member. Based upon the scientific studies, it is seen that the professional commitment is the most important to be taken care by the board members, that they are representing healthcare team. The board meetings have to be taken as seriously, understand the purpose of it, what is the structure of that, and how it functions, and legal and ethical process of conducting meetings, etc. It's entirely different from direct patient care in the hospital as well as policy. But it's also important to develop these skills. So the second thing is about the communication, the productive communications, so how to express the ideas and convince other members by listening, reflecting, clarifying, and validating others' view and networking. At the same time, the managerial skills like conceptual skills, critical thinking and strategic planning, etc. to lead effective and efficient board meetings, and managing conflicts is also important to function as a board member. What I really wanted to say is that we have to understand the fact that we are a part of a larger group. Our activities contribute towards the common goal of human and social welfare. So hence, it's the responsibility of nurses as well as the opportunity for the nurses to participate in policy making. But are we effectively contributing or not? Yes, in few developed countries, they recognize the importance of nursing. As I mentioned, the skills or competencies that develop as a part of their education as well as experience are being utilized for making better policies. But in our country, it is still underutilized. There are certain strategies which are there to develop these competencies. To say few, the meaningful interprofessional education and interdisciplinary mentorship, the facilitation of skill development and recognition of opportunities to serve, integration of financial and policy topics into the undergraduate and graduate level of curriculum, and support opportunities to develop the financial and policy skills. We as the nursing professionals have the responsibility to support the budding nurses as well as young professionals to participate in decision making right from the bedside to the unit level and departments, as well as at the organizational level, by involving them in various committees. And through this exercise, people can develop this skill of contributing effectively in the board meetings. For these things, there are certain global initiatives also. We all know that the year 2020 was considered as a year of nursing and midwifery to communicate the significance of this profession for achieving universal health coverage and sustainable development, for which the Nursing Now campaign was initiated in February 2018. And I also quoted the DG Tedros at the time of launch, in which it was requesting all the policymakers to invest more in nurses and improving their competency and giving them opportunity to utilize their education and training to the fullest to meet the healthcare needs of the world. Following which, in July 2019, Nightingale Challenge was initiated, where the request was made to at least all across the world, 1,000 employers were requested. We have to identify the 1,000 employers who will invest at least 20 nurses below the age of 35 to develop their leadership and managerial skills by mentoring or giving them opportunity in multidisciplinary trainings, so that they will be able to lead nursing profession as well as the healthcare team. And for anything, it is also important to have data, for which the State of Nursing Report 2019 was the first effort to collect data about nursing across the world. And the second State of Midwifery report was developed in 2020. The Nursing Now Challenge, after completing 3 years of Nursing Now campaign and 1 year of Nightingale Challenge, the Nursing Now campaign and Nightingale Challenge has converted into Nursing Now Challenge in June 2021, with an objective of championing leadership development opportunities for 1 lakh nurses and midwives in more than 150 countries, with which there are opportunities provided to various countries by the WHO and other developed countries to contribute and invest in nurses in their country. And finally, there is a strategic directions for nursing and midwifery. That is the strategic direction of nursing and midwifery, May 2021, under which there are 4 key areas which is there. It is education. The midwife or the nurse graduates match or surpass the health system demand and have the requisite knowledge, competencies, and attitudes to meet the national health priorities. The second area is job. This increase the availability of health workers by sustainable creating nursing and midwifery jobs and effectively recruiting and retaining midwives and nurses and ethically managing international mobility and migration. And the third key area is leadership, to increase the proportion and authority of midwives and nurses in senior health and academic positions and continuously develop next generation of nursing and midwifery leaders. And the final one is service delivery, where the midwives and nurse workers work to the fullest extent of their education and training in a safe and supportive service delivery environment. These are the platforms which are provided for the nurses with the support of nursing agencies and organizations all across the world. And the India being a member country of WHO, we are also following in the same line. As I mentioned, we have to consider that we have to work, think globally and act locally, and understand that we are the part of a larger system, and the small and efforts which are done at locally will have an impact. And now we all can understand that health is not a state, not limited to the state or an individual or an organization. A health issue or a problem in any part of the world is a challenge to other part also. And this pandemic has proved it all the more that the challenges have been increased. Hence, my request to all my fellow colleagues are think globally and act locally, contribute in smaller steps so that develop nurse leadership in the nurses at every level and give them an atmosphere to involve in decision making. Right now, I am in a multidisciplinary mentorship. These are certain efforts doing by the government, recognizing the importance of nurses and their key competencies required for meeting health needs and universal health coverage. We all are aware about the initiatives under Ayushman Bharat, where nurses are utilized as community health officers who participates in Rogi Kalyan Samitis and give their together, they take decisions which is best for the people of that health and wellness area. And we also have midwife-led units where they give key inputs for the management of the labor rooms as well as the maternal and child health units. So the environment is there. Now the opportunities what we have to utilize, and so it is both the responsibility as well as opportunity for nurses to contribute effectively in the team, in the board, for taking correct policy decisions for the healthcare delivery. Thank you once again for having me among you, and wish you a great success for this webinar and a great learning for all the participants.
Thank you so much, madam, for your kind and knowledgeable words. As we know that nursing is called the oldest and the renowned profession, and healthcare is constantly changing and having the updating in healthcare field. Madam, you have clearly stated the initiative taken in the policy making decision on nursing profession globally. You have brought out the component of SDM 2021, that is education, job, leadership and service delivery. I hope that students follow that the one punchline of read, lead, and succeed. And here you have mentioned about that these components are very important for the professional growth. And I would request the participant, if they have any doubt, anything they want to clear, they can just mention in the chat box. That can be taken in question answers round. And I thanks you once again, ma'am, that hope your all these efforts, mission will bring changes in the success of nursing profession. Thank you so much, ma'am.
Thank you. These are all the efforts with all nurses participated, and I thank each one of you for contributing towards such good decisions for the nurses and also for utilizing these opportunities. I thank each and every nurse. Every nurse matters, and I thank them for their significant contribution. Thank you.
You have given all very clear, and you have shared your experience, which are very meaningful, ma'am. We are so much thankful and we are humbled that you have given time in spite of your busy schedule, ma'am.
I just wanted to share, this is a nurse mentoring, multidisciplinary nurse mentoring. Under the government initiative, nurses are used, taken as the quality assessors. And there are MOUs are there with various organizations to invest in the leadership of nurses. Various training programs are planned. So the nurses have to utilize these opportunities, develop their competencies, and continue contributing in the way they are doing. Only thing is that to visible as leaders.
Thank you, ma'am. And now we move to the next session. That is an important part of our webinar is panel discussion. Without wasting any time, I would like to call Dr. Sneha Vaidya, who is working as a Regional Nursing Director, Western Region, Apollo Hospital, Navi Mumbai. Dr. Sneha, madam, is PhD, MSc in nursing. She is instrumental in service care delivery, improving work scenario and empowering organization all across Mumbai like Nanavati Hospital, Global Hospital and Leelavati Hospital. Madam had a significant contribution in field of nursing research and publication. Dr. Sneha bagged for the Team Nursing Excellence Award and CAHOCON and CSSD Award. Today, I request Dr. Sneha to share your experience in a subtopic on transforming nursing practice to improve care. Dr. Sneha, I welcome you in this panel discussion, and I would just like you to please clear the image that how a novice to expert in nursing profession, how we can build this image and what protocol to be followed. Please, Dr. Sneha.
So, namaste and good afternoon to everybody. So, I have just very few slides on how I would take this entire journey. It reminded me when I was just going through, what should I really talk to this young generation who is going to prepare themselves into this community of nursing, whether they will be at the bedside or whether they would like to be teacher, whether they would like to be at the community. It's all mixed kind of an emotions that is running currently at the mind of a single nurse. So I thought, let me take them to certain things of how, one could guide themselves to achieve what they have to be. So I remembered a saying by, one of the Director General Tedros of WHO, who had quoted that the pandemic has reminded all of us how much we all depended on nurse from our first days to our last, and why all countries must invest in nurse, new and for the future. It's a very profound statement if you see, because we all had witnessed that all of a sudden during pandemic, it was the nursing fraternity who was in the front, who was battling along with the patients to get them out of it and even putting themselves into this risk. So I always feel that as a nurse, how important we are to the community, how important we are to the entire world. And what is the importance of, yes, we must have learned a diploma in nursing, or we must have learned a graduation in our nursing. But in the end, it all led to a single path that is nothing but patient care. So I'll take you through few slides that will remind us that what it means to be a nurse. What will your role be as a nurse? I mean, what does it look like to be as a nurse? I always feel that if you take this profession, okay, you entered as a student, but now you're going into a world where there is a lot of complex things. There is a lot of complex situations around you, a lot of complex situations in healthcare. So the first thing that you need to know, or you need to have as a nurse, is you need to be sensitive and sensible. What it means to be sensitive? Sensitive is nothing but to be compassionate. If you do not carry that particular quality in you, it's so inborn in a nurse. Not everybody can be as compassionate. You cannot be able to deliver that particular kind of care that's required. And when you are sensitive, you have to be sensible. Because when you're compassionate, you know that you're giving the right care to the patient. Now, as a nurse, when you be sensitive and sensible, you know that when you have to plan your patient care, you know how you need to implement that care. And once you have implemented means once you have given that care, you know you need to evaluate the impact of the care that is given to the patient. Because every care that a single nurse will give to the patient will lead to the recovery of the patient. In workforce, during the work schedules, a nurse should be able to make sound clinical judgments. There is a situation where your patients are sick. There is a situation where your patients will give you an alarming trigger. And that is the time when a nurse has to be really, really judgmental in order to take that correct decision, to make a call to the clinician or make a call to say that my patient is in trouble and I need help. The nurse has to find that the work is meaningful and fulfilling. She should feel satisfied. Being at the bedside is not just having a one lunch and a two punch kind of a situation. She has to feel that, you know, I am over there to bring a difference in the life of a patient. Every time as a nurse, whether you work as a new registered nurse to the N number of experience, definitely it is a requirement that you need to upgrade your clinical equipment. Keep reading. There are so many new things that are coming into the market. So you need to read and you need to be over there so that you are able to take care of your patient with the latest technology or with the latest programs that are available over there. Participate in educational programs. It's very important. It's very important because there's a lot of learning. There's a lot of knowledge sharing that happens in educational programs. Determine your future path. As a new registered nurse, when you're out into the world of the healthcare, there are many possibilities of what you want to become. Be sure, keep your path very clear with you of what you want to become in life and find your place in healthcare. Whether you want to be in education, whether you want to be in the clinical service, whether you want to be in the technological services, like where artificial intelligence is taking up its roadmap along with the digital media, whether you would want to be part of it, you have to find your place in the healthcare so that you can pose out as a better challenge into the healthcare industry. Now, what is the need for innovation in nursing? We are speaking, I mean, many speakers will have a lot to speak on this, but I have few things what I felt that I should talk to you all is, you have to maintain a quality in the healthcare services. If you are a nurse, you need to know that every patient who walks into the hospital requires quality care. You cannot be doing a care just for the sake of doing it. Be competitive in technology. Now, technology is taking over. There are so many technologies that have come into the market. I can just share a few because I think so. I have another speaker who's going to talk more about artificial intelligence. If I have to give an example of robotic surgeries being very much as a part in the operation theater. So a nurse knows how to be at the console, and the nurse know how also to be at the at the bedside and handle along with the surgeons the robotics. If I have to talk about technology, I talk about interfacing about the vital signs that are there that are entering into the digital media, and many more to talk about that. Increasing advances in healthcare field, different innovations, different kind of materials that are entering in case of invasive procedures, in case of other procedures that are there are getting competitive in origin. Emerging clinical and nursing specialties. Today, a nurse doesn't recognize only as a nurse. She can widen her horizons and become, I've just quoted few examples, become a wound management nurse, become a pain management nurse, become a chemo nurse, a nurse practitioner, which is just emerging in India, or even become a nurse informatics specialist. Why I'm talking about nurse informatics specialist is where a concept of EICU is taking place. It is taking place everywhere. So an ICU nurse can participate of where she can give her information of identifying the triggers of just looking at the screen and providing that information to another nurse who is there at a community level. So this is how you can have different kind of innovatives that are there in the nursing, and she can look forward. I will conclude that a nurse who is there, she should know how to think. If she can think, she should know how to access. She should be able to know what is the latest thing in the healthcare field. If she knows how to access, she should know how to interpret, how to read, how to define, how to conclude, and how to use the knowledge that she has in her. And that can define how to be the leaders and how to defend their ideas. My dear team members, my dear nurses, all that I will tell you is the knowledge in healthcare is like an ocean. It's like an ocean. You may find many sharks, you may find, many things. You have to be a shark in that ocean. Not to go and attack anybody, but to be competitive in yourself, to be competitive in your own ways, so that you know how to take forward this particular journey as a nurse. And that's the message that I will leave for everybody. Yeah, thank you so much.
Dr. Sneha, thank you so much on a practical and a very easy word. And you have focused on the two important work, that is sensible and sensitive. I think it covers empathy also for a novice. It covers full, a complete definition of a nursing. Thank you so much, ma'am.
Thank you.
And
thank you.
One important trend in nursing you have mentioned, that is increased specialization in nursing. So, ma'am, I would just like to ask for how many specializations like you have seen are now students and even professional people are opting.
I can talk about many nurses who enter into the field. I can especially talk about nurses who are entering into hospitals which are quaternary or tertiary hospitals, and where these accessibilities are there. Like, for example, I can talk about hospitals. Suppose if you have a theater and where you have robotics, and a nurse starts, first she may start just becoming a new registered nurse in the operation theater. But as she shows her inclination, her competencies, her skills that are there, when she starts increasing and starts building on that, she tries to channelize herself and understands that I can do much more creative and enter into the field of a technology that is just very much there at a hands-on. And she herself can be over there and participate and check with the operation theater in charge that whether she can be a part and start, you know, even learning. And it is very important for a nurse to take that step. Many a times nurses shy away thinking that, you know, how to go about. I do not know. I don't know whether I'll be able to do that. I don't know whether I'll be able to pick up that challenge. But she should be able to believe in herself and take up that challenge and go ahead and ask. And nobody is going to stop a nurse from learning. I'm very clear and I'm very sure about that. So if you see in across healthcare, you will see many specialist nurses across, and they are just going and venturing out and seeing what will work best for them. And once they have specialized, let me tell you, they even go and do a lot of research, and they themselves go and, you know, build a horizons of building another path which becomes specialized on their own. So I feel that there is a lot to learn, and I really request this young generation that is, you know, this young budding generation that is full of knowledge and full of intelligence. Please use your intelligence in the right direction. Hospital requires you at the bedside. The patients requires your you know, your intelligence, your skills, your drive, your enthusiasm, your compassion at the bedside. So please see that you do not waste, and be one of the most important component of healthcare, where I talk about, you know, as clinical partners along with a clinician. You can be partners with clinicians only when you use your equipment correctly. Yeah, that's all I can say, Dr. Geeta. There is many more.
Thank you so much, ma'am.
Rest of the
I
speakers
know,
have
ma'am.
lots to talk about. Yeah, thank you.
Thank you so much, ma'am. And now we move up on to the next panelist, that is Mrs. Saino Thomas, who is a Group Chief Nursing Officer and at present working in American Oncology Institute and Citizen. Madam is an alumni of IIM Indore. She is a healthcare leader. She has a master in hospital management and master in pediatric nursing. Madam had an international experience as group head in Aster, UAE and Bahrain. And at present, the madam will be taking a topic of mentorship, which is a key competency in nursing profession because it reflects leadership. So madam, I would just like you to explain that how this is a pride of our professional nursing practice. Welcome, Mrs. Saino Thomas.
A very good afternoon to all the panelists here, to the chairman and to the organizing committee. Thank you so much for giving me this opportunity to be a part of it. I welcome all the participants who are hearing me in person as well as virtually. I would like to just take these next 15 minutes to share my thought in terms of how the experience of mentorship has been for me. You a thought that when the students are prepared to come on to the clinical setting and the existing clinical people who are there already working, how can we make use of this mentorship? And if we are presently not looking at mentorship as an important element, let me start. This is a very beautiful picture which I always like. This is kite flying in the sky. So once a father was teaching his son how to fly kites in the sky, and then he was very expert around it and kept flying very high in the sky. After a while, the child said, I mean, it's really high, but if you cut it loose, I'm sure it will fly very higher than what it is already flying. And the father knew what will happen, but he thought, okay, let the child say, let's do it. And then what happened? He allowed the child to cut the thread. And the thread was cut and the kite flew definitely higher than what it was flying. But after a while, the kite started dropping down and, it came down to the ground. So then the father asked the son, what do you see? He said, oh, I thought probably cutting it would give it more wave, and it will go much higher into the sky. But it did not. It went down, it would have been better that it would have been tied. So that's what mentorship is all about. The thread which the kite is tied is the mentorship that we all get in our life, and then it's when we cut the connect between somebody who can help us to reach to that height, we really lose ourselves and come down to the floor. But this thread which is getting connected, if it remains there, it will help us to be more higher than where we are. So that's the gist of what mentorship is all about. Next slide, please. So in the gamut of mentorship, it is important that we look at a mindset and new results which come out of this. And when mentorship is there in picture, there are two different elements which are there. One is a person who would be the mentor, and there is a person who is a mentee. And most of us, when we move in from educational setting to a clinical setting, we become a mentee. So there would be questions in the minds of the new budding nurses. I learn a lot of things over here, but practically, is it different? Practically, definitely, there are a lot of things which are different, because the curriculum over which we learn teaches us how to become a very good clinical nurse, how to become a very good patient side nurse. But when we come down to a real working scenario, the organizations and the hospitals have a lot of other things. Apart from patient care, we are also looking at a lot of accreditations which happen either through bodies like NABH, JCI. So the functioning completely changes, we have to look at a lot of documentation, policies, procedures, and we have to look at the value of every organization is different. Today, every organization wants to have a culture of themselves, and as a brand, everybody will have their own values and philosophy with which they work, the mission with which everybody works. When you change one organization to another organization, our mindset has to accordingly tune to those culture and the mission and the vision of that organization. So how will that be bridged? So we see here that, we learn a lot of things from the education institution, a lot of theoretical knowledge is there, okay? And in the land of clinical practice, we have to have these opportunities to implement those theory into practice. And the mentor over here is going to help us to bridge this. There's a huge gap and mentorship can bridge this up. So in clinical scenario, how things work, okay? We see here that there are goals which have to be there for a mentor and a mentee. Now, a person who is going to be a mentor should validate the mentor's leadership skill, his own mentorship skills, whether they are good at it. So they come off with their experiences or with their knowledge background or with the education qualification that they gained with. Then they need to be recognized as an advisor. You need to have a senior person in the system who will be considered that they are expert in their area. And these are the guys who are preceptors. They are the ones who are certified. They are being tested that they are the good guys who are going to be able to efficiently mentor somebody. Thirdly, they need to be learning how to clearly communicate. Communicate whatever is the real essence in which this particular buddy has to come up to on board. So that is important from a mentor point of view. It is also important to gain new perspectives. Now, nursing is not the same, which is around 20 years back or 10 years back, or, the millennials whom we are dealing with today. There is a lot of difference between the way people think. The culture has changed. It is a lot of tech-driven system today. So there is a lot of change and innovation which keeps on happening in all provisions. So it's very important that the mentor also understands the changes around what's happening in terms of the field, in terms of the philosophy, in terms of the technology, and brings in the new perspective from the mindset of the people whom they are mentoring. It also is important to give back and find new talents. Okay, so as we heard a lot about how pandemic has helped us to learn and evolve, it has given a lot of open-mindedness in terms of accepting freshers also in the system. So there's a lot of things which happen, okay? Now, from a mentee point of view, now you start and you join an organization. So you are the one who's going to be getting, I'm the one who's going to be receiving it from a mentor. What am I supposed to be prepared with, Understand that we need to learn the workplace culture. As I mentioned earlier, every place have a culture of itself. What is the whole imbibed value system of that place? How does this place work? If you understand that, it will be very easy for you to amalgamate with that changing process. Accelerate the skill development. Accelerate means to speed up. Now, somebody can learn in 3 months, somebody can learn in 6 months, somebody can take 10 years also, and they will not pick it up, But it's very important. If you put conscious effort towards picking up those things, you will be able to. Because whatever we learn in 3 to 4 years is not just sufficient to have the skill competency needed to have a live patient and to manage around 6 to 7 patients with a lot of efficiencies in 8 to 10 hours of duration of a shift. So we will have to enhance and we will have to go on, incapacitating ourselves to ensure that we are doing skill development. Expand your professional network. Very, very, very important. I think A lot of organizations which have now come up specifically for nursing, groups which are, professionally connecting people. There are groups like Annie, there are groups like INS, there are more other people, now the nurses are professionally connecting. This helps you to learn together. This helps you to have a knowledge sharing with each other and get those perspectives in place. So it's very important that you have professional networking very strongly built up. You can have it for your city, for your state, for your country, or even cardiology, then the cardiology network. These are examples. So you need to have expanding these professional networks. Transfer knowledge, whatever you are good at, make sure that you are making it as a point to expand your knowledge by giving it more. The more you give, it's a ripples effect. That's how it works. And gain professionally. These are some basic goals which both the mentor and the mentee should have. So in that gamut of understanding, when we look at the aspect, why is it not? Yeah. Could you enter one, please? Yeah. So what are the tools that, nowadays you to map it up and to game it up? Number one is induction. As much as any good, strong, process-oriented hospital would be, they will have their process of induction. Induction would be a structured process where different topics are all finalized. Number of days will be fixed. In that area, a preceptor, a nurse educator who will handhold us in getting it inducted. Some inductions would only be theoretical, some inductions would be theory and practice, and some would be role-based. For an in-charge, for a supervisor, for a nursing head, inductions will vary. So inductions help us to get into this. So as soon as we go into a hospital, which is very structured, they will provide us processes with induction and they help us to get into the process fast. Second is competency mapping. Now, what is competency mapping? Every area of work, whether you work in an ICU, whether you work in a cardiac area, whether you work in a cath lab or an operation theater, or even in a ward, every nurse needs a specific competency required. Yeah. So these are tools which are there in most of the organizations to map. So there will be a self-assessment which you do to tell what exactly you are aware of. And then we also realize the gap which is there between what you know to what you need. And then those training needs are built up to build up this competency. Thirdly, there's something called credential and privileging. Okay. Now you may be working in a medical surgical area for 2 years. Now what do you want? You want to grow into an intensive care nurse. Intensive care is a different specialization, different skill altogether. Now there are no gamuts available that you go and become a good ICU nurse. There are programs which are there, but it also helps you to have practically without leaving a job, be in the same setting, work around in a mentorship, and then get privileged to work in an ICU. And then after professional observations and all, you become a level 1, level 2, level 3, and that's how you are upgraded into it, and these privileges get added. So these are some methodologies which are there to make sure that the organization helps you to make mentors and brings it up. And of course, a buddy system, somebody who is very strong, somebody who is very experienced, somebody who is very recognized by the system as a buddy will help you. There are some self-monitoring things also which you should keep in mind, which will ultimately help us to grow in both laterally and vertically. Self-monitoring, make sure that all of you are, even when you go and start working, learn all the diagnosis, whichever you are going to be commonly facing with. 20-25 diagnosis will be very common. Make sure you're thorough around the pathophysiology and all the disease conditions around it. Make yourself thorough with all the medications that you use in the system. 20 to 25, 30 drugs will be there, which you commonly use in a particular area. Make sure you're thorough around it. Mentor yourself by knowing the investigations, the normal value around it, the value above it. When it goes beyond the range, what will you do during those situations? If you are doing this, you will be thorough and confident in facing all situations. Most importantly, have a very strong communication, and communication should be strengthened by using a very important tool called AIDET. A-I-D-E-T. What is this? In your communication with the patient, acknowledge the patient, introduce yourself. Wherever there's a duration required with the right time, how much time the surgery will take, how much time the report is going to take and time to come. Have that in your conversation of discussions and explain. We learn a lot in our nursing education also. Explanation of procedures is very important. Explain everything so that you set expectation and patients will be ready to cooperate with you when expectations are set. Lastly, thank you. Thank them for using your services. Thank them for allowing you to help them in the path. Okay. This helps us a lot of growth which is possible for us both laterally and vertically. Laterally, you can take up the role of that operations. You can become a CEO of an organization. There are so many nurses who have, who are excel to that extent. Customer care is an area. Guest relation is an area. Patient care experience and coordination is an area. You can look at industrial nursing, telemedicine, school. These are only few which I have listed. Apart from that, you can vertically grow in the same department as an in-charge, as a supervisor, as an assistant nursing superintendent, as a chief nursing officer, as an infection control nurse, as an educator, as a quality nurse, as a diabetic educator, and many more such roles which are evolving. Nurse practitioner is also a role which is now recognized by INC. You can do that. You can interpretive practice in anesthesia, in OT, okay, and in cardiology as well. These would be then, helpful to have. And then whenever you go into the hospital setting, and what should you look forward from a mentor? They should be able to, you should always have that approach to help them in job orientation. They will help you in career transitions. They help you in enhancing the skills. Mentorship helps in professional and personal development. It also builds up the confidence, and it becomes a technical advisor, and it is also helping in correspondence, communications, which become very important in the initial and the crucial stage of life. Okay, with this, I would like to say some few strategies which can help, simple ones which could help us to be, mentoring and building up this mentoring relationship more stronger. The mentor and the mentee both should be committing to each other. Secondly, we need to develop trust. It's very important that people who are going to work together and mentor each other, and the mentee should have developing a trust of relationship with each. Have your goals very clearly set, timely goals, a very structured understanding of what you will achieve within what time. Have your roles and responsibilities very clearly stated with each other, what is expected, what is not expected, and collaborate for results. Work together to make sure that everybody works towards and achieving this. Lastly, I would like to just conclude by putting a video over here that here, the famous personality over here did have the strength, did have the courage, did have the skills, okay? But only when a mentor came in the picture, she was able to use it correctly. Thank you so much. I think this is something which I wanted to put, that we may have all our skills, but if we have a right mentor, he will take us to those destinations which can work out for the best of us. And it will also help us to save our time to receive that. And there's no substitute for hard work. Thank you so much for giving me this opportunity. I hope I've done justice to the discussion which we had now. And I again thank the organizers for giving me this opportunity. Thank you.
Thank you so much, Mrs. Saino. You have clearly confidently bring out the image of mentorship and how it helps not only for professional, even for the personal growth. And very nicely, you have mentioned that this mentorship we can practice at unit level, organization level, and national level. Thank you so much, ma'am. And that video of yours, I think it will be giving us more impact on our brain to think about the term mentorship and how it can bring the changes in the life. Thank you, ma'am, for being here.
Thank you so much.
And now I would move to our third panelist, Dr. Gopi Chandran, sir, who is Associate Professor in College of Nursing, AIIMS, and having the additional responsibility of as a President, TNAI Delhi branch, and the Founder President of Society of Cardiac Nurses. And as we know, one of the important trends in nursing practice is online mode. And so Dr. Gopi Chandran will be explaining us that how the nursing professional should adapt for to the digital future, and how this online program will have a positive impact for their educational and for their professional growth. So I request Dr. Gopi Chandran to please come and give your views about it.
Okay, thank you for Dr. Geeta for the introductions, and really it's a very good afternoon to everyone. So I'd like to thank Chairman and all the panelists, chief guests, nursing student, faculty over here. So very good afternoon to everyone once again. First of all, I thanks for the invitation and sharing my thought on it. Actually, I was really impressed with the last two speakers. They were really highlighted about that. How that especially for now we prepare the nursing student to go into the today, what challenges they are going to face and how they overcome to prepare as a as a quality nurse and an empowered nurse. What we expected, that really I think they are the today from their talk they have to take into the different way how we expected from this outcome of this forum. So we cannot forget our lady with the lamp. She is our pioneer, and also today we are, this forum was majorly focused on the innovations and how we being a nurse, how we be the better innovators, and which we are able to improve the patient care outcome. And also definitely the nurses today globally, they emerging or emerged as a different role as a clinical nurse, nurse specialist, or administrator, educator, researcher, whatever it is. Exactly, they were nurse need to be, as a nurse, to be very compassionate. That's what our the quality which can be compared with the doctors. We will never compare with them, because we are our unique professions which project to them how we are, how that we are able to accept or recognized by the community. So the same way, she as a compassionate nurse who today everyone, either not only as even doctor, still they used to remember Nightingale because of her compassion. She is not only compassionate, she is the first scientist and is a statistician. That still we have to be proud of that, because today nurses can innovate, nurses are can able to do innovations, or they are able to do innovation, or they may be the scientists. Still there is a query, there is a question, still we are not able to reach some status over in India as compared to other country. But still she already proven almost 100 years before her era, between 18 to 20, 1910, that time itself she all called or emerged or maybe proved as a nurse scientist. Because the reason is, she always to say that she always believed that nursing has the responsibility to promote the health of any human. That's what their concept. That's why she proved as a nurse scientist. And again, it's come to that today, 2020. You can see these two situation context. In medical community, they are innovated, or maybe they done they contributed to the society by world first living donor lung transplantation during the time of COVID-19. It happened in Japan. Everyone the eyes are open, and all people are talked about it. It can be possible. It's happened after a long time. During the COVID, we know that the lung was everyone they were working on how to get back from after the the effect impact of the COVID-19. But same thing happened in another place in Brazil. The nurses, they also made the innovations. They just simple. It's very without spending any money, without the cost. They used 2 gloves filled with the warm water. They put together, and they were satisfied the patients. The patient also satisfied. They feel like someone holding his hand. They named that as a God's hand. And they were clinically also, they improved show the outcome. The patient perfusion and saturation was improved. That's they didn't spend any money. They are just use the material with this. That is what nurse, that we call it with that with our compassion. We understood that patient is the whole. It's a holistic manner. We are, even though we work on to whatever the previous speaker mentioned, that have different role as a specialist to monitor the parameter, report to the doctor, administer medication, still as a curative, but still we expected that we supposed to all the time look into the patient as a whole, that understood such something ignored the patient. Even though the patient is survived, even though patient symptoms is reduced, something need to be something is ignored that I have to overcome as a nurse. That's what had done it without any resources. That is the innovation today nurses are doing in 2000. That was same innovation, same kind of compassion showed by the Nightingale 100 years. Today, the same nurses, our nurses community following, with the manner which they projected. That also today open our eyes that nurses always innovated. So, but same way, another end also nurses are criticized that same kind of repetition doing in thesis and dissertation, some kind of study replicated, that also putting that down, that they all the time invent the same, that means invent the same thing whichever we are testing the same hypothesis many times which already proven. That also we are happening in one end from nursing community. That also criticize how nurses, why nurses not is a good innovator, means why nurses are not proving it's a scientific manner. So that's why we always expected that don't reinvent the wheel. That is our concept. That's why nurses today somewhere else accepted, recognized with their compassion. Another way, sometimes the quality of the work which is showed, that need to be enhanced to prove, and that how we scientifically we are professional. This is what nursing today between still we are since from Nightingale to today, how nurses continue and what we expected in the society to be the innovator or the nurse scientist. That is what the talk today from my side with my own experience. So here you can understand again COVID, bring to the COVID, because COVID, we cannot forget it. COVID taught us a lot, made us to understand, and again to bring it post-COVID to use or to lead on the life in a different manner. That is one of the most important things is technology. There is no doubt about it. The technology, adapting the technology by nurses, it is now easy, because earlier I was worked in in different platform, different area, even in Gulf country in AIIMS. Nurses used to resistant on that. I cannot use the laptop, I cannot use the computer for entering the patient data. Now they are adapted, because earlier very difficult to use the mobile phone. Now all mobile phone with different manner, where the same function which is happening in everywhere in other sources also. That's why the technological adaptation is good enough for nurses, not only any general public nurses. There is no doubt about it, because during the COVID, we were all forced to adapt this technology. It's better than earlier. That's what the truth. That is no doubt about it. That same which was we are showing that by it's accessing the healthcare, or maybe getting your food, or maybe the education, exactly, that even we were thinking that how we can able to complete a course of the student, but we are used to different forum to help us to complete that all theoretical part. Even we are not able to do the clinical side, but still we were able to clinical part. And even though we stimulate the student with the different sources of the by clinical situation, to make them to understand the concept of how you have to react, how to respond, and the kind of simulation learning also we made through the digital sources. So digital is the one now. It's always now with along with our life. And it is not only for our promoting the health or preventing, or whatever we are used for prevention of the health, and the education also, in especially nursing education also, we are very well utilizing nowadays. So many countries, including this today forum, we are using the digital mode to complete and inspire and also motivate the nurses to learn many things. That is no doubt about that. We are extending and going to the different level. But same time, we are utilizing for that. This is what today the concept, utilizing the digital, the health for the patient, especially for prevention of the disease, promoting the disease. That is need of the hour. That should be understood by the nurses, understood by the public, understood by the medical community. That should be most important. That's bring the outcome that we maybe missed out many things before. Now that is helping us to overcome many health issues, and also to preventing most of the diseases by getting the many data, and that able to follow up the patient, that improve the patient's outcome, and in many outcome like decreased mortality, decreased morbidities, improve the quality of life of the patient, reduce the admission rate and reduce the readmission rate. Again, it is increasing the drug compliance. That's all many outcomes today improve because of the kind of the digital health or digital technology that really help the patient to come out nicely. Otherwise, and also the patient experience, even the healthcare worker experience also feel more better, and also reduce the time, and also it's reduce the error. Most of the error can be managed through the digital. That's what I can very happy to say that we were even I am today assigned as a e-governance as a coordinator for today for AIIMS Delhi, because AIIMS Delhi is a leading institution in India. We have the tertiary hospital. The patient come from across the India. So it's a blood and bed strength also more, and patient flow is more. We can expect number of patients for visiting the outpatient and admission is more. It's very difficult to manage physically, and a lot of physical work, paperwork, that is very difficult for nurses today manage. So we are expecting that to do paperless work, and same time transparency and reduce the error, and again that kind of maintaining the confidentiality. These all also to be taken care. That's why, but still we are able to overcome, and that's overall outcome is to improve the clinical outcome. That's what our overall objective, patient care outcome. That also to achieve through these digital. That really it's the momentum is coming in our India, because it happened in the AIIMS Delhi means definitely the momentum will go to everywhere, because changes happening in public sector hospital. It is not easy. because we have a lot of resistant workflow changes, and again from financial capital, so many things, budgeting, so many things are always challenges to overcome, and again from changing the work culture of the nurses, doctors take time, but still it's happened at the AIIMS Delhi today. That also is going to transform to every hospital, that really make the changes of the outcome of the patient. It is not only I'm talking about the changes happening in the services, and also changes happening in the nursing education also. So I want to just share two experience with you that today's session, because I always most important to what Dr. Chairman told, instead of talking with a slide topic, we have to share our thought and vision and experience that really make the student, the younger generation, to go further to improve, or maybe they can be better tomorrow with the take home as a message. So I had, when I was joined at the AIIMS in Delhi, I was, I'm specialized in cardiac nursing, and I'm the educator, researcher, and different area. I'm working in, almost for 25 years. But when I joined at AIIMS Delhi, I understood one thing very clear with the concept. I mean, it's one thing, I felt something with this patient, what they are suffering, and what, especially the patient group, or maybe I can say the targeted patients are like patients who are with the end stage of diseases like heart failure, renal failure. The patient really come from different places where they get treatment from at the AIIMS Delhi. Again, after that, they go back to the home. It may be 300, 400, 1,000 kilometers far away from the home, from the hospitals. If something happened, because they are not sometimes end stage of disease, their drug compliance is poor. The reason is they are poor because of disease, they become poorest. And the reason is they are not able to spend money for the drugs. Sometimes they take medicine from AIIMS, but they complete the medicine, they will not buy medication, they spend the money for the family, because they may be the only the one to buy in the money, and it's for them, it may be they maybe don't have money to buy the medicine. That is one problem. Another one, maybe they're depressed. Anyway, my life is over. I am the example, heart failure patient from stage 3. This is the progress in nature of the disease. They become stage 3, they think that anyway I'm going to die, why I have to spend money for me? So better that my family should be better. So this kind of problem patient is facing today, end stage of diseases. Otherwise they wait for transplantation. Sometimes they may not get organs, or maybe the donor to get the transplantation. Even if they get transplanted, again they go for drugs or immunosuppressive drugs post-transplantation. This is a burden for them. That's why these kind of patients need to be followed up. That follow-up is, there is a gap that is always there, because once the patient discharged from AIIMS Delhi, we don't have a system of follow-up, what they are doing, who will monitor them, how to remotely monitor them. That is the biggest questions which it came in mind. And our Dr. Sandeep says is the number one physician, he's a cardiologist, and he's known with his vision and his work. He is my team, and we were all nurses in the team. We decided that we go for the one kind of the product, that is mobile app, which is be also part of the digital health. So we made this that 1 and 2, which help the patient to remotely monitor their parameter, because we have different parameters, cardiac parameter, ventilatory parameter, renal parameter. We have different parameters. Some parameters are core parameters that we wanted to look into, that whether they have problem, or maybe their symptoms are existing. Like patient with the edema, the weight gain is more. Patient have some arrhythmia, they may have the change in the heart rate, or change in the ECG, or there is change. The patient may have landed in cardiogenic shock, the BP is varied. So that all the core parameter, we want to look into that. That's why we made this app. That app is really worked out, and we tested with many number of patients, which proven that this app, continually we were able to monitor the BP and heart rate and the weight. They were every day, because that earlier we thought that how the patient may have mobile phone, because they are very poor. So we are understood that after some time, everybody, whether they take food or not today, everyone have mobile and any Android phone. And there is today everyone, we are able to access with some network, because every mobile data some kind of have kind of memories. I mean, which will be able to use it for their for their purpose of any reasons. So that's why we were tested before going into this type of work. We understood that, we did some kind of explore that, or be able to use this type of app. Then we understood, we realized that, we validated that. Then we went through this type of app with the help of collaboration of IIT Roorkee, because they also came forward to help us. Then finally, we were able to, that's because the nurse was one which is innovated with the collaboration of the, cardiologist, and also with the collaboration of the IIT Roorkee, with the guidance and again mentored by Dr. Sandeep. So we were able to configure this app. And other than that, we also able to, they can able to share their any kind of investigation, because they are in Bihar. They cannot able to go to the doctor. They cannot able to get anything to be done for emergency. They can share that all kind of ECG, their X-ray, that also able to do that. This app really made the changes in the outcome. I told you that is especially readmission, especially for patients who wanted really the treatment and for accessible the healthcare but emergency. This all taken care by the heart failure nurses, because we have nurse-led heart failure management. We have we prepare the heart failure nurses. They use the app which were installed for the patient purpose. This is what the background of the development of the mobile app on heart failure that really showed the outcome. And we also have trend also their example. Every day they enter their patients, their weight, the BP and the heart rate. If changes happen in between this from yesterday to today, any 10% changes happen in the rate, this parameter, the alarm will, message will come to the doctor, message will come to the nurse. We will also reinforce them to go to the doctor immediately nearby or ask them to come to AIIMS. And we will also keep ready their, for the emergency to receive the patients, that type of, remotely monitoring and continuous, follow up. And again, we also able to understood that whether they are able to cope up the drugs and cope up the diseases, because coping up the disease, cope up the drugs is really challenging for end stage of the patients. And same thing happened with the cancer patients. Again, we understood that patient cancer pain also one of the challenges. They may not able to adapt the drugs. They may not able to they may also poor in drug compliance, especially taking analgesic or any kind of narcotic. And again, they have developed some complication due to palliative management, or maybe the drugs which are taking due to palliative a kind of cancer management. They developed a constipation, nausea, vomiting, and poor adherence. Then we decided after this, success of this, which improved the outcome of the heart failure patient, I turn into this area in the cancer patient management, especially palliative management. And then we decide to develop the app. This is supported by ICMR. Initially, for first one, which is supported by IIT Roorkee, that I didn't get the fund that time. Still AIIMS is supporting in some parameter. But this time, with this, this improved the outcome of the patient. They, ICMR came forward and supported me. Then they brought this, they were supported with, provided the staff, provided so many technology, including this, from ignorance. So we have developed this app. This is for the palliative management, which we assured that, where we found some limitation in the previous app, like a issue with the, internet, patient not able to access because of the network problem, or patients not, taken medicine. There is no alarm for the last app. This time we made alarm. And again, these all made new changes. Patient itself, they can, drug complaints also we added with that. Every day they take the medicine, they will, press it. And with that, how many doses they can, when they get taken. Because it's come down, so we developed as a e-prescription. Because earlier we write in the paper, patient may not understand what type of drug. Now we made as a e-prescription. Along with this, also the patient can give the report on their pain level, either they have any worst pain or they have any symptom developed. These all report come to the doctors and come to our, nurses and our team. We are able to help them. We also have web pages, which is developed by AIIMS and along with ICMR. We entered all the medicine. Whenever the patient comes, we are, because this is a app, earlier one, it was in Google, it is available, you can download, but this one is, it's a copyright. It's still with us. We are not giving to anyone who are patient registered in our, in the trial. And it's a password protected login ID and username. We are giving to the patients. The patient only can use it, or family member can use it. Then they can all the time, they can able to, access this, and also they can enter, and we are able to follow up. And again, we are show that result already proven that they are improved in their compliance, their morbidity reduced, then symptom is reduced, then they are really, their quality of life overall this improved. That's a very difficult to achieve quality of life. That's why the technology, adapting the technology, use the technology the right manner, how that improve the patient care outcome. That was shown through these two mobile app, which is the practicing now made as a culture now today as used by all the patients. Now the government of India is also recognized our app for in the different way. So here also the patient, when the doctor don't have time to see everything, they will look only the map. That is also add on the future of this app. How the patient pain was from yesterday to today, how is there any worst pain was happened. This is only this page the doctor able to see. That also will help us and to to doctor take correct decision, because clinical decision to manage the patient. This is the happy to say that when the nurse innovate, that also today recognized by the government, and especially from the Prime Minister office, we are given that the national. Why I'm expressing to just motivate the young people, because always we are really passionate and compassionate, but sometimes you need motivation. That motivation also helps to move further, which really to this, because all nurses empower, they for empower the community, empower the nation. That is our overall our achievement. So developing the digital capability is the nursing to ensure that all we keep pace with the digital evaluation of the healthcare sector, allowing them to reap the benefit of going digital, also enhancing the patient care. Thank you once again for giving me. I know I took more time, but still I'm very happy to share my thought and vision, which also to empower the students.
Thank you, Dr. Gopi. Thank you so much. You have explained about the importance of the digital technology and how it helps to communicate and become more efficient from the patient side, as early diagnosis and effective treatment can be possible. I'm so thankful to you. And I hope that in another sessions and all, you can bring us more practical aspects of this digital technology. Thank you so much.
Thank you. Thank you.
Yes. I invite Dr. VK Singh, sir, to just, as sir, we lost the connection in the initial inaugural address, that sir, please come and just explain about your visionary words.
Okay, thank you, Geeta. I'll not take much time. We are already overshot by half an hour. And I also have to go within 5 minutes to another session somewhere abroad. So anyway, I've got the whole flip of it. I just wanted thank you for all panelists and the people who are listening. My more talk is concentrated on to the younger ones who are listening. They are one who have to come. We created this forum just to update you what is happening in the world. We are not going to talk the basic nursing. We are going to talk of cyber security, artificial intelligence, hackathons, IT management, cyber security, etc. And we'll organize all this discussion and talks so that you are updated when people talk. They understand, yeah, I know it. I have learned it in the member of the forum. So forum membership is open, and all of the Geeta, Prasanna, Sanjay, and also Indra, I think she's not there, will help you to become. We'll open up the various chapters. Whole idea was, I have seen myself in the being a senior medical person. I was heading Navy Medical Services in Bombay. So I know that of course, in Army, we are doing much better as for nursing part. That even Niti Ayog said, and he told me their things have to be brought up. Now, they definitely, what is really required is, this club is only for that. I was trying now, I'm happy that it has come up, and we will have every month, and you will have opportunity to do the training, attend the club meetings of which is a part of whatever as a member, which you will be invited, all the letters, newsletter, pulse, etc. So that you are really you are something which when people talk, you are not really taken back. What is this supposed to be? Incidentally, Dr. Gopi has spoken. We are having a digital health conference, which is an international conference, people coming from abroad. We'll give you opportunity, those who want to talk or those who want to be participant. This is in collaboration of IIIT Delhi along with the IC, which we have been doing such conferences. We even take tours abroad, etc. So ultimately, this conference is again, I'm glad on the digital health, because that's going to be big thing. If you don't come up onto that, if you really want to progress, you will be left behind. 5G, fiber optic, all these infrastructure are already in the offing. Something has already been declared, and this will be the thing of the nursing integrate onto all this. Today and tomorrow, this is what you should plan if you want to develop in your career. I was telling you that if you have anything we have conducted a World Bank nursing superintendent, and I was really of the district hospital. I was really very taken aback that how badly they are being, and they said in 25 years, this is our first training. So don't worry, we'll do something, we'll declare a calendar of 6 months, we will train you, etc. So for that, you just become member, that is not for profit, etc. It only covers and from the next our forum meeting, it will be only members. This is opened up for everyone this time. And we will have people, experts from abroad, nursing people, and all the people who have achieved something in their life. I'm glad Dr. Gopi has already got the innovation, and that's my heart of the thing that what would be in the future. And many things is this. I've heard about this app of this. And ultimately, there is a lot of money lying which is not being utilized, which is lying with the government. So I want the forum members, one day I should feel proud. 10 of my members have got this grant and they are working on this. We'll help you out. We have capable. My partner, who is now in Norway, is double master in cybersecurity and he's working a lot in health. Also, he's a technology fellow, he's not a doctor. So that is the one. He will also work quite a bit in health, and he will also take you to the next step. I'll not take much time of yours. I just wanted to, if you be member, I think it will help. It is not a very big amount, very small amount. And those who want to really join in digital health conference international, it's for 2 days conference. It is on 9th and 10th of December in the IIT Delhi. And as a speaker or as a delegate, will be there most welcome. Sanjay will facilitate that your entry into whatever. Sanjay, you flash the thing, send all the mail to all the people who have attended today, along with your number and mobile, etc., all the information, so they become part of the thing. They get the newsletter, pulse, etc. And every month something will happen. It is not that we will declare a calendar for next 3 to 6 months, and so that you can decide your convenience. It will be run by you. You tell the topic, you tell us the time. If you think we should be in the evening, we are open to that also. Evening, 6 o'clock, 5 o'clock, whatever time you want, whatever day you want. We want people, nursing, to be benefited. It is already India and abroad. Nursing profession is now not that lucrative at all. Some nursing colleges are closing in abroad, I know it, and also in down south, because IT gives better pay, less number of hours, more satisfaction. So let's make it lucrative, and let's make it integrate them into health, and we will do that, so that they're very important people to deliver. Otherwise, the health system will collapse. There's no doubt. I had a lot of interaction with Niti Aayog, Dr. Vinod Paul, and he also feels something must be done. and we would do that. Thank you very much once again. Next time we will have one other topic. We will talk, integrate, talk, discuss, take question answers on to, and we will let you know well in advance that these are newer topic which we will be talking. Thank you, all of you, Sneha, Dr. Gopi, and Thomas, etc. Thank you.
Surgeon Rear Admiral V.K. Singh, Dr. Rathi Balachandran, Dr. Sneha Vaidya, Dr. Gopi Chandran, Ms. Saino Thomas, Dr. Geeta Parwanda, and all participants. Good afternoon. It's an honor for me to thank you all on behalf of the Nursing Innovator Forum. I would like to express my gratitude to each and every one of you for your presence and contribution in making this webinar a remarkable success. I extend my gratitude to our Honorable Chief Guest, Dr. Rathi Balachandran, for taking out time from her busy schedule to address the webinar. Thank you for your enlightening speech. I would also like to thank Dr. Sneha Vaidya for her insights into how we bridge the gap between our education and organizational expectations. Dr. Gopi Chandran for his take on how we go about digitalizing nursing practices, and Ms. Saino Thomas for talking about the need for mentorship to improve nursing outcome. Special thanks to Dr. Geeta Parwanda for skillfully moderating this webinar, and to Surgeon Rear Admiral V.K. Singh and Captain Indira Rani for organizing this webinar and guiding it to fruition. Last but not the least, I thank each and every one of you who participated wholeheartedly in this webinar on this lovely afternoon. Thank you.